Hello and welcome to NAHCA Talk second show. My name is Wendell. This is my lovely co-host Angel. I would be remiss if I didn't mention the NAHCA 2014 conference. We had a great time. We had some great speakers. I would like to say thank you to Lori, Lisa, Jeff, and to Medline, and to all our Key to Quality award winners. Congratulations, and to the 500 plus CNAs that attended the conference. It was great having you, and I hope to see you next year. I would like to take this time now to introduce Choice Rehab's July CNA of the Month, Raven.
Hi. I would like to thank everybody at Choice Rehab for appreciating hard work. I'm going to keep working hard to make our building proud, and thank you.
Thank you, Raven.
Today we are live at Choice Rehab in Sun City, West Arizona. Now today we'll be talking about free dental care. That's right, free dental care. You might be wondering, how can I get this fantastic deal? Well, by doing proper mouth care.
Well, Angel, let's start the show.
All right, let's
Thank
do
you,
it.
ladies, for being on the show. If you would, could you introduce yourself? Tell us how long you've been a CNA and how long you've been employed here.
My name is Evangeline. My nickname is Yvonne. I've been a CNA for over 20 years. I've been with Choice Rehab for over a year.
Thank you.
Hello, Wendell. Hello, Angel. My name is Monica. I've been a CNA for 1 year here at Choice Rehab.
All right. So, ladies, Yvonne, Monica, you guys know that today's show is on mouth care. With the first question, I would ask, what are some of the struggles that CNAs encounter doing mouth care?
Patient being resistant. Timing. Because if they've got like therapy and stuff like that.
Their schedule. Right.
So, like the time that they get out of bed, or
Right.
Yeah.
yeah. What can CNAs do to help provide proper mouth care?
I would say one of the first things that you would do is just use your common sense. You know, you have a routine going, you know, just like you do for your own self, you're going to do that for your residents too. You care about them, and you're going to give them the kind of care that you would want for yourself or someone in your own family. You just start with morning and, you know, do the dental care or, you know, their oral care first thing in the morning. If you can, you try to get it in at lunchtime, you know, brush their dentures or brush their teeth, you know, give them, at least offer some kind of mouthwash. Another thing you do, especially at nighttime when they're going to bed, is to, you know, if they do wear dentures or any kind of partials, is you take them out and you soak them overnight with the tablet. So,
Person-centered care. I mean,
just like
that's
you would
what
do for yourself or anyone else in your family.
That's so
Right?
true.
Now I'm going to ask some questions. I know the job of a CNA can be quite difficult, but how difficult can it become when your residents have dementia or behavior issues?
Your timing. When trying to get oral care done, if they're taking a nap and stuff like that.
Yeah, you'll often run across a resident that sometimes will become even more resistant than normal. Not always the case, but you know, you definitely want to revisit it sometimes. You know, give it a few minutes, come back to it, and try it again at another time. You know.
When providing mouth care, what are some of the things we should be looking for?
I would say you're going to look for the smell of a bad odor coming from their mouth, from any kind of tooth decay. If there's food in their mouth, the smell of food, you know, food, like Evangeline mentioned, you know, pocketing of food. You want to see how the reaction is, you know, when you're trying to give mouth care. Are they wincing? Are they pulling away from you? Are they trying to be resistant to it? There's an issue there. You need to check it out further.
Or if they're having any kind of pain.
Right.
Now, what are some of the negative outcomes of poor mouth care?
Nutrition. Pneumonia. Death.
Yeah, and there was an article in the Knight's magazine on mouth care being the leading cause of death in long-term care. That's really a big one. It's really important.
So what about the nutritional aspect of poor mouth care in a resident?
One of the most obvious is weight loss.
Yes.
Weight loss. Yeah. Smell of tooth decay. Kind of things when you notice your resident isn't wanting to eat, especially when it's one of their favorite meals.
Right.
Because a lot of residents do have a favorite meal. When they don't want that anymore, you know that there's an issue inside the mouth probably.
Yeah, that's true.
Or they got their gums or their teeth and they're like this.
Right.
You know there's something wrong.
Yeah. And you find it a lot in dementia residents.
Yes.
You know, they really love to grind their teeth and that's it.
Or even teeth breaking.
That's right.
Yvonne, Monica, any last words, anything you would like to share?
Well, I know we both want to thank the owner of Choice Rehab, Paul and Phil. And we want to thank the amazing staff we have here, all our administration, and the great CNAs, our peers. We have a pretty awesome team here.
And our NAHCA team.
Absolutely, and we want to thank all of you for having us.
All right, well, ladies, thank you, Yvonne, Monica. Thank you for being on the show. It was really a pleasure being here with you. Thank you very much.
Thank you for having
Thank you.
us.
Thank you, Monica.
Thank you.
Thank you.
Stay tuned for our LOL.
Funny thing about oral care is that if you have a resident who wears dentures, you need to always check on them after they leave because sometimes they like to take them out. Well, I had gotten a report that one of my residents had lost his teeth, his dentures, and at one point when I was going to turn him over for last rounds, don't you know it, there they were right behind him. Another incident happened with another female resident who wears an upper denture and a partial bottom. I had noticed when I come on shift that she didn't have her teeth in, so we were going to dinner. I asked her, let's put your teeth in, darling, and she adamantly refused that those were not her teeth. Some of the things that happen. Sometimes you just have to revisit it and come back at it from a different direction. That's it. Thanks. That's my LOL.
Thanks for being on the show today. If you would, could you give us a little background on who you are and what you do?
Yeah, first, thanks for having me on the show. My name is Phil, originally from California. Been in the Valley now for about 15 years, and I've been practicing mobile dentistry for those 15 years.
Thank you. It's a long time.
Yes, it has gone by fast.
So Phil, there are thousands of people that would like to know, what does DDS stand for?
DDS, I get asked that a lot. It stands for Doctor of Dental Surgery. There are two types of doctor degrees you get for dentistry. One is the DDS and the other is DMD, Doctor of Medical Dentistry. They're both the same, you have the same merit, just depends on which university you graduate from.
What are some of the best ways, Phil, that we can educate our neighbors to take care of their teeth and gums?
I think first and foremost, we must, as a staff and as healthcare providers and care providers, make sure we understand the importance of good oral health on total health, as well as the vast negative impacts that poor health has on negative health, such as, diabetes, chronic illnesses, chronic infections, heart disease, and things like that. So once we get able to educate them on the importance and how those links are connected, it takes on a different meaning. It makes oral health more important instead of just a mundane routine we do to kill bad breath and keep our teeth clean. They understand that it's more than just good oral hygiene, it's actually good health.
Okay.
I know you see a lot of mouth care issues. What are some of the common dental concerns facing our neighbors and residents?
Most common ones we see are, this heavy plaque and capillaries buildup. We see a lot of just what I call rampant decay and breakdown, just teeth literally just decaying and falling apart. And we see a lot of the dry mouth, secondary to a lot of medications that they're taking. So a lot of our efforts are headed towards combating those three areas. That's the biggest and most common thing we see throughout the valley.
Okay. And how can we assist our residents in preventing teeth decay and gums?
Well, we have a unique population amongst our residents. We have those that are, total care, some that require assisted care, and in that, your ability to provide oral care changes. For those that can provide self-care, we can encourage and enable them to do that. That'll be ideal. Those that are willing to allow you to do it and give you access to it, then you can help those do that. Some, they're combative. If you get up in the morning, you get the clothes on and fed, you've done your job for the day. But the most part is, encouraging and helping those that can do it themselves do it, and assisting those that allow you to do it as well. There's other type of aids you can use, like an electric toothbrush. It has a real thick handle, so those that have dexterity problems, they can use those to help brush their teeth and things like that. And also, it'll help with the aides and the nurses in providing oral care, because they have that manual dexterity, just turn it on and kind of run it along the gum line. Use of water picks. There's like dry mouth aid, like Biotine products that help reduce dry mouth, combat those things. So there's a lot of little topical aids and dexterity aids that can help provide oral care.
So Phil, I've seen a lot of your work. Kudos to you and your assistants. You guys do a great job.
Thank you.
But has the mobile service really made a big difference in how the neighbors receive their mouth care?
I would say yes, and I realize it's a biased answer, but obviously yes, because we're serving a population that kind of falls in the gap. Those patients who don't have family members or the ability to get out to dental care themselves, or they don't have means of being transported out of the facility for many different reasons. So I think yes, if we have that made an impact, I would love if there was 100 more of myself out there doing this, because the need is great. But like I said, we hit those patients that are unable to get out either due to behavioral issues, access issues, or just medical issues. So those patients who, for whatever reason, can't get out, we're able to go to them so they do not miss that opportunity.
Mm-hmm. And I know at this particular facility, I know you guys, deal with a lot of the behavior
Yes.
neighbors, So to me, that has to be hard,
It presents a different challenge, but we've been doing it for a while. We know what to expect, and we understand that their behaviors aren't necessarily directed at us. It's just a component of their condition.
Mm-hmm.
So we try to help them just like you guys do. And in this stage of their life, this is where they're at, and we have to meet that need at this stage, and we try to do our best to do that.
Thank you.
All right, now, can you explain how the mobile dental service has helped our residents?
Kind of piggybacking on the previous answer, like I said, a lot of times these patients aren't able to get out. You guys are kind of unique here. Sometimes, a lot of our patients are hooked to ventilators and things like that, so those patients are in a very different situation. But sometimes, like patients here, because of dementia, because of medications, because of mobility and things like that, they can't be transferred from their dental chair from their wheelchair to a dental chair. They can't, they have back issues, they can't move. So we have to work in the setting that they're most comfortable in, and that's where we kind of come in and fill that need. Those people, we can do our best to get to them, and take care of them. So it is a challenge, it is different, it's not the glamour field of dentistry, but it most definitely fills a need.
So Phil, do you have any last words you would like to share?
Yes, thanks for having me on first, and thanks for calling us out to take care of your residents. We appreciate that, and we take great pride in being able to do that. From an oral care standpoint, I just, we have your staff just, have them, every now and then look at the patient's mouths, just every now and then lift them out and look in there, because sometimes they can't communicate pain, discomfort, and swelling and things like that. So every now and then, your aides are doing their rounds and just doing their rounds. Just have them take a peek in their mouth, just look around for something that looks kind of unusual. You see something on the left side that you don't see on the right side, it's kind of, that should, kind of raise a red flag or something like that.
Okay.
All right.
That is definitely something we would do. We would definitely share this with our peers. And Phil, with that said, thank you for being on the show.
It's a pleasure to have you. Thank you.
Three words of the whack, step yourself back, cause we're getting down and in it, giving no slack like a Burger King with a sack of Big Macs, with throwing down and with the rock bulls axe one time. In your mind, you see, you gotta boogie to your best ability. You gotta funk it up until it knocks you down, and when you funked enough, make sure you pass it around. Come on, let's go to work. We got what'll make your body jerk. Make you throw your hands up in the air, shake your booty and scream, oh yeah, cause we are the Jam On Crew, and jamming on it is how we do the do. We'll funk you up until you boogie down, so come on people, check out the sound.
It might seem